What is complicated grief, and how is it different than acute grief? Unlike acute grief, complicated grief is severe, long-lasting, intense, and debilitating, often interfering with daily tasks. It occurs when mourning is not addressed, but is ignored or met with maladaptive behaviors. So, who is at risk for complicated grief? Those who've lost a life partner or child, those coping with a violent death, or the elderly have higher reports of complicated grief. And what happens when complicated grief is not treated? Sleep disturbances, cancer, substance abuse, cardiovascular disease, and suicidal tendencies are a few of the possible outcomes. And what happens with treatment? Clients are able to discuss their loved one comfortably, experience reduced symptoms, find support within their community, and reconstruct meaning in their lives. Consider this case study. Maya, a once energetic and vibrant mother, lost her husband of 10 years unexpectedly 1 year ago in a car accident. She has young children to care for, but finds it difficult to care for herself most days. Maya feels as though she can't move on from this and that things will never get better. She quit her job as she couldn't get out of bed most days. Similar to many others with complicated grief, Maya finds that the condition has drastically impacted the quality of life of her and her family. If this sounds familiar to you, you're not alone and help is available. Let's talk about some specific techniques. Practice telling your story. For many with complicated grief, talking about the loved one and sharing their story can help process the loss. Doing this in a creative way with the direction of an expressive art therapist is shown to be beneficial. For Maya, this might look like sharing her story through writing, talking about what her husband's life was like and what his passing has been like for her. She may also want to get her children involved. Telling a story can be done through creating a collage to honor his memory or other artistic means. They might fill their collage with things that remind them of their dad, pictures of him, or things their dad loved. Working with a professional is another invaluable resource. Some techniques you might encounter in therapy are complicated grief therapy and expressive art therapy. Complicated grief therapy incorporates practices of PTSD treatment and cognitive behavioral therapy. Expressive art therapy incorporates the arts to focus on reconstruction of meaning. Both are effective in helping those with complicated grief work through their grief to come to a place of acceptance. Maya's therapist suggested she attend an expressive art group therapy. There she learned that she was not alone in her struggle. She found support and encouragement from others going through the same thing. Maya's days in bed were a thing of the past, and she began to find ways to integrate remembrance of her husband into her daily life. Reaching out for help is the first step towards healing. You're not alone, and there are people out there who want to help. The following resources are a great starting point.